Good morning, everyone. Thank you for attending our Good Ideas webinar. Today, it's going to be focused on vaccines and their impact on education this fall. My name is Victoria Graham, and I am Good Reason Houston's Manager of College and Career Success. Like many of you on this call today, I am a mother, and I'm trying to navigate and manage all the information out there about vaccines and in-person schools and learning as we all try to make the best decisions for our health and education of our children. For those of you who do not know us well, Good Reason Houston exists to accelerate public school improvement across Houston. We believe that every child in every neighborhood deserves access to a world-class public school education. And we know that learning in a high-quality school can change a child's life. Preliminary estimates of learning loss paint a dire picture of the impact of the pandemic on our students so far. Many of our most at-risk students are falling further behind during this time due to the new barriers such as lack of access of internet. Also, districts are reporting tens of thousands of students have simply vanished from area enrollment. And many students who are enrolled are attending so infrequently that they're actually at risk of failing one or more classes this school year. This just underscores the importance of in-person learning for our city's school children. As you know, the vaccines play a vital role in helping to get our goal of safe, healthy, productive in-person education. While vaccines are now available to all adults in the Houston region, questions still remain. How and why should I get a vaccine? When can my child get vaccinated? What might a return to full in-person school look like next fall? Here to help us navigate the ever-evolving health information pertaining to COVID-19 vaccines is Dr. Ryan Neal from Houston Methodist Hospital. Dr. Neal has been in medicine for 3 decades. He is a board-certified internist and is currently division head of the hospital medicine at Houston Methodist. Welcome, Dr. Neal. We're so happy to have you join us today.
Well, thank you, Victoria, and thank you guys for having me this morning. It is indeed my pleasure to be here to share whatever information I have with the group and to answer any questions that I can. Full disclosure, I'm not a pediatrician, but our adult medicine service actually manages patients from age 16 and up in Texas. So we have a significant experience with those patients who unfortunately have been sick enough to be admitted to the hospital. And by taking care of those patients, it's made me a very strong advocate of the vaccines.
Awesome, and thank you for that additional context, Dr. Neal. So we're going to jump right in with our first question. Can you just tell us a little bit more about yourself and your experience with COVID-19 and the pandemic?
Sure. So, as you mentioned, it sounds scary when you say it. I've been in medicine for 3 decades, and I've actually been in Houston for that entire time. A year ago, when we started to understand that we were admitting patients with a viral syndrome who were very sick, that was later identified as COVID-19, we had no idea what we were in store for at the beginning. We initiated all the appropriate protocols that we knew to initiate at the time. We followed guidelines that we understood in the beginning. This is March 2020. Of what to do. And as we saw patient after patient coming in, we recognized that we were really in a situation that for most of us, or maybe all of the physicians who practice, had never seen or been a part of before. So the historic component of COVID-19 and the pandemic has touched every life in every arena. And my bias comes because I am a hospital medicine physician. And so I actually get to treat the sickest of the sickest patients when they come in. And those patients, despite the concern with older patients having severe disease, which is true, we've admitted patients across the board, 18-year-olds, 20-year-olds, 30-year-olds, 40-year-olds, 50-year-olds. There's no decade of life that has not been affected by this vaccine and that I've not personally seen and had the opportunity to take care of. In addition to that, I will say that even some of my first patients were also teachers, and they had, specific concerns for both well-being and health. And as always, teachers always ask very good questions. Even early into this, they were asking the question of, how do we protect the children, and what do we need to do, and what are our next steps? Early on, we did not have all of the answers for those questions. I think as the data is coming out, we have more and more information that we're able to use to the best of our ability through CDC, through NIH, through the Association of Internal Medicine and Pediatrics, that I think are giving us reasonable guidelines on what to do as it relates to prevention of this horrific disease. We now know that the vaccines are safe and effective. We can go over those in detail to the extent anyone wants to. And that really makes it imperative to follow the mantra that we in healthcare believe: get the vaccine as soon as you can, particularly when you're eligible, whenever you can, maybe with a few specific caveats, which we can discuss. But in order for us to be able to attempt to bring this pandemic to a halt, we have to all work together for each other.
Thank you, Dr. Neal. And you mentioned talk about the vaccine and the different options. Will you just talk us through what are the current vaccine options we have at the moment, and perhaps what are some of the differences that exist between them?
Sure. Thank you for that question. So, the first vaccine that came forth was Pfizer. I'm a part of the Methodist system, and healthcare providers, of course, were required. And trust me, we were standing in line to get the vaccine after having taken care of so many sick patients. The Pfizer vaccine is a 2-dose vaccine. Immunity is usually achieved 2 weeks after the second dose. The Moderna vaccine soon followed thereafter. It's a 2-dose vaccine. And immunity is usually occurs within 2 to 4 weeks after the second dose of the Moderna vaccine. Both of these are similar in structure. They're messenger RNA vaccines. They both have about a 94 to 95% efficacy. And what that means is about more than 90% of the time, they prevent severe disease and the consequences of severe disease. And that's very important. It's probably, biased me from the standpoint of I get those patients who have severe disease. The third vaccine, the Johnson & Johnson vaccine, which rolled out maybe about 2 months ago, and transiently went on pause for episodes of increased thrombotic risk, but now is off pause. And I think that the FDA did their due diligence along with the CDC and sort of making recommendations that overall this is still a safe and effective vaccine. It's a one-shot vaccine, so it makes it very easy to be exported to different communities and confer protection even sooner than a 2-shot vaccine. But there is a caveat and a pause from the CDC recommendations that adult women who are under the age of 50 might want to consider balancing the risk if they have the option of both having a Pfizer Moderna compared with a Johnson & Johnson. They just want to make an informed choice. Having said that, there's still less than a 1 in a million chance of a severe reaction, even with Johnson & Johnson, and less than 1 in 500,000 chance of a thrombotic complication.
Thank you, and thank you for walking us through some of those differences. The next thing that I want to talk about, still as it relates to vaccines, a lot of people who on the call today may be wondering, the vaccines were brought to the public very quickly. How safe are they? How does that all work, Dr. Neal?
Sure. It's always a little nerve-wracking when we sort of watch things play out in public on the media and try to understand and fill in the gaps. Having been a clinical researcher in my former life, I understand the process of clinical trials, getting things to market and moving things along. The science for the vaccines and this particular changes in the vaccines has been going on for decades. The ability to accelerate what you can do in a clinical trial has a lot to do with manpower, energy, and support for that entity. And clearly, when you're faced with a pandemic, all energy, all sources, all manpower hours go to solving this problem. And so the expedited process of the vaccine did not impair the safety review. It simply sped up the steps in the research process. And instead of these steps going in sequence of 1, 2, 3, 4, one was going while two was going, while three was going, while four was going, to get the process up to speed to be researched for safety. But the data safety, the number of people who had to be screened, the length of time of the clinical trials did not change from the standard, only getting it to that stage and then getting it available to the public were the expedited processes. So I, having taken the first vaccine when it was immediately available, have no reservations with the safety. Clearly, when we have a clinical trial of 30 or 40 or 50,000 people, and then we get it to 100 million people, we will see what's called the post-marketing effect of those things that come up because it's a 1 in a million episode that we'll have to sort through as we go along. But I have every confidence in the FDA, the CDC. They're boards of course, great minds and scientists, but they're also human beings. But I think they'll always make the best decision that they can possibly make for the public. And keeping in mind they're American citizens who have families, who have children, who have school-age children, and they're making these decisions for them as well.
Thank you, Dr. Neal. You mentioned this kind of in your intro that teachers ask the best questions. And a lot of teachers are asking questions around when and how should they get the vaccine and get vaccinated, and when and how should parents be getting the vaccine. So can you talk a little bit more about that?
Sure. The greatest concern we had when we first got the vaccine out, and everyone was pushing for 50 million doses, and we knew there were 350 million Americans plus and 250 adults, was that how are we going to get it to everybody we think needs it? And now a lot of those numbers have changed. We now have more than enough vaccine for everyone, and it is widely available. President Biden's address on yesterday touched on the availability, and I think he said, I'm paraphrasing, that at this point, 90% of Americans are within 5 miles of an availability of a vaccine. And that's just incredible. In addition, we're getting more and more data on the effect of the vaccine, the post effect of the vaccine, and those benefits. So if I were a teacher, and I am a parent, I'm even more than a parent, I'm a grandparent of a school-age child, so this is very personal to me as well. We would want, and they would want, and I would want everyone to know that it is important for all of the adults who have our availability to get the vaccine to get that. Clearly, there are a lot of folks who still have questions and some hesitancy around the vaccine, but we know that these vaccines are overall incredibly safe in comparison to many of the drugs we use for simple things that are even over the counter. These vaccines are very, very safe, and they're effective. They're effective at preventing us from losing more Houstonians, losing more Texans, losing more Americans. It prevents mortality from the disease, and it prevents hospitalization from the disease, which unfortunately some people who have that level of severity don't leave the hospital. And that's what we as clinicians, particularly in hospital medicine, are trying to prevent as much as possible. Parents probably also, and even I as a parent, have a due diligence to protect and care for themselves so that they can care for their families. But in addition, protect even their families, because one of the things we understand from this disease is that 80% of the people who get it may be asymptomatic, but it doesn't prevent them from transmitting it to someone who may become symptomatic. And so even though we don't have all the answers for transmission as it relates to even the patients who've had disease or those who get vaccinated, it's very, very important that we do the best we know how to do with the science we have to reduce the transmission effect, and reduce the number of people who are getting sick. And we've been effective in that. We've watched hospitalizations drop, we've watched cases drop, we've watched mortality drop, And that is all directly attributed to the number of people who are getting vaccinated.
Thank you, Dr. Neal. Something else that comes up when people research vaccines is something called herd immunity. Can you explain herd immunity and how do we achieve it?
Sure. So depending on which data set you look at and which virus or pandemic you're discussing over time, herd immunity usually occurs somewhere between the 70% vaccinated and or patients who have contracted disease to around the 85% category of fully vaccinated and or people who have had the disease. And people say herd immunity. Well, if that's the case, then I've still got 15 or 20% of the people who might be able to be infected. Well, the reason that herd immunity works is it stops the transmission, so that if one person even has an asymptomatic infection and they're around 3 other people who are vaccinated, those people don't get the disease, they don't contract the disease. And we hope that with the data that comes out, we'll find out that they're less likely to even transmit asymptomatic disease. So herd immunity becomes critically important, and some of that's global, but a lot of that's regional. So we talk about it in the context of the United States and America. For those of us who are going to be within the states 90% of the time over a course of a year, that protection needs to be there for all of us. And if we, and one of the things I'd caution is not to become complacent or comfortable because we don't see the numbers going up in the media. We don't see the pictures of the patients in the hospital in the United States. You have no further to look than the media in India as to what's going on, and understand that this disease is by no means eradicated. This fight is not over. It is not time to relax and see what happens. We still have to be diligent and proactive in everyone who can get the vaccine to get the vaccine. And just so you know, while these cases and these numbers are down, I personally, I'm still admitting patients with COVID who are very sick from COVID. And just because the numbers aren't high doesn't mean they're not there. They are there. And some of these patients, percentage of these patients are folks who are less than 50 years old. So there is still the presence of disease. You can still get a severe case of COVID pneumonia, even though it's not sort of being sensationalized on the media. And we should take every precaution to protect ourselves.
Thank you, Dr. Neal. Something else that I wanted to touch on, because I know people on the call may have questions around where do we currently stand with the medicine around vaccine availability for kids under 16? So right now, of course, students or kids 16 and older are able to get it, but has there been any movement for a vaccine for kids under 16?
Right. So, I mean, a very good question, and I want to, qualify that with, again, I'm not a practicing pediatrician, but a studier of the science understands and knows that. So, the reason that the 16 and up group was able to come to a recommendation is that they were included in some of the earlier trials of the previous vaccines, and it was found to be safe and effective, even though that was a smaller group, and so the recommendation could be made. Both Pfizer and Moderna are now looking at clinical trials with 12 to 17-year-olds and expect to begin clinical trials in younger kids over the next 6 months. Having said that, I don't think we'll have any solid recommendations for preteen and teenage kids for at least another 3 to 4 months, probably, unfortunately, not before the start of school next year. And we probably won't have information on younger kids until the latter or the mid part of 2022. But having said that, make no mistake, everyone is looking at the data. There is not a pause to not move into clinical trials and get that done. Everyone is pushing for the clinical trials to be done on this group of patients. And in addition to that, looking for the data surrounding patients who might be at risk, who have comorbidities, even though they fall outside the age group. So the pediatricians and the individual pediatricians and those individuals who follow with the physician should be able to get recommendations from those physicians as it relates to their next step with the vaccine as well.
Thank you, Dr. Neal. So a follow-up question to that. It seems like the best case is that a few months from now we may have guidance for preteens. But if a vaccine for kids under 16 is not available this fall, what precautions should educators and parents continue to take to keep schools safe?
That's a good question. As it relates to the movement in the healthcare provider arena, the mantra is that if you are going to take care of, as it relates to us with patients, if you're going to take care of patients, whether they have COVID or they don't have COVID, you have to protect them as well from the disease. And to do that, you yourself both have to be vaccinated and be cautious. So even though the majority of hospital workers are vaccinated, we're still wearing masks. We still wear a mask inside the patient's room. We still wear a mask and ask the patients to wear masks to protect everyone, even as we approach or attempt to approach herd immunity. That is no different, in my opinion, in the classroom. That teachers, when we send our kids to them, have the duty to protect the children to the best of their ability. And clearly to protect them against the potential transmission of a virus. So it not only is important for the teachers to be vaccinated to protect themselves and their loved ones, but also the students. In addition to that, since we do not have vaccine capacity available immediately for the younger school-age children, we still have to follow the CDC guidelines. We have to follow the precautions. We have to, keep them in their appropriate mask, keep them at their appropriate distance, keep them washing their hands and being safe in the classroom and inside the school. That is a tough job. It's probably one of the hardest jobs there are out there right now. I could not imagine the pressure of being a teacher and having to feel the onerous and the pressure of protecting, all of my students who are with me at any one time. I'm sure, that is a daunting task. We'll all have to do the best we can with what we have, and hope that the school system supports the needs of the teachers and the parents and the children to get these things done and to keep schools moving forward, to keep them open. I agree. I think in-person learning is impossible to achieve virtually. I think clearly children and particularly children at risk need to be able to engage their teacher, they need to be able to engage their classroom. There's even the socialization perspective of that even though it's barriered, has to still exist. So I would say again to all the teachers, all the parents, get the vaccine where you can, when you can, and work effectively with the school district and school district work with the parents to make sure we have in place these parameters that kids can get back to school, get back to their education, and do it safely.
Awesome. Thank you, Dr. Neal. So just a closing question. Is there anything else that you would share with our listeners as we look forward to a return to full in-person school in August?
Sure. I mean, as we look across this and as we look back, we'll probably see things we learned over the course of this time period that might change the way we do things forever. When we sort of say get back to the norm, and then we quantify that with the new norm. I don't know to what extent we'll be able to get back to our full normalcy. The CDC has just released new guidelines for fully vaccinated people versus those who are not fully vaccinated, and I think those are reasonable guidelines to follow. What I would caution is that again, just because the guidelines are opening things up and relaxing restrictions, we should not extend that relaxation to those things that are still restricted. As a community, we owe it to ourselves and each other to make people aware if we are vaccinated versus that we are not, and that if we are not, we're going to follow those recommendations for those folks who are not. It becomes important for families to talk to families. I mean, I have members of my own family who have different perspectives on vaccine and vaccine hesitancy, but if they come to me, they're going to get the same message. And over time, I think what has become the issue is they've become more comfortable with the information and they're moving forward to do the right thing. And with that being said, I would just caution everyone, just because we see the numbers going down, just because we see hospitalizations going down, and thank God, because we see mortality going down, it is not time to relax those restrictions. It is not time to relax caution. And nowhere is this more important than in the school, where particularly elementary school, school-age children reside. And we, as a community, have a duty to keep them safe.
Yes, we do. Thank you, Dr. Neal. So that's all the time that we have for today. I want to thank you, Dr. Neal, so much for participating in this very important discussion and really sharing your knowledge, your expertise, and your personal experiences working on the front lines, working during this pandemic. So we thank you for that, and we definitely thank you for your service, Dr. Neal. And then I'll close by saying, I hope you all will join us for our next Good Ideas webinar. It's going to be May 11th, and it's going to be with Aldine ISD's Chief Communications Officer, Shalia Reed. And we'll be discussing what equity for students looks like. You can register for that webinar on our website, goodreasonhouston.org/events. Thank you, everyone, for listening, and hope you have a great afternoon.
Have a good one.